Okay. Good morning, everybody out there. I'm Jay Remley with the Lupus Foundation. I'm Vice Chairman of the board on with the Lupus Foundation here in Northern California, and welcome to our office hours with Dr. Parsa this morning. Dr. Parsa, it's always great to see you. Good morning, sir, and thanks again for supporting the Lupus Foundation and joining us here in our community to answer their questions and what might be top of mind. A lot going on this week we're going to talk about in the past week. So thank you for joining us and welcome.
Good morning, Jay, and the audiences. It's a great, having you here, and thank you for having me here to talk with our lupus patient and public.
Absolutely. For those out there joining us, as you know, we do this every couple weeks, Saturday morning with Dr. Parsa, and it's really a chance for us to engage with Dr. Parsa and his medical expertise, and at the same time answer questions coming in from many of you. So again, just as a reminder, up here behind me, or the other side, sorry, is you can get all the information you need here and stay up to date with us at lfnc.org/COVID-19. And then if there's any questions that come up along the way, either during our event here, feel free to include those questions in our chat. Or you can email us at communications@lfnc.org, and we will answer them either here live or we'll get back to you offline, after the event. So with that, again, welcome, and we'll try to keep this to about 30 minutes. And there's a few topics. There's one question that came up since our last office hours, which was just before Thanksgiving, and we wanted to touch on that. And then, of course, this week, there's been a lot of news in the world of medicine, especially around COVID and the new vaccine. And so wanted to get Dr. Parsa's take on that and what that might mean for the lupus patients and community out there, as well as GSK and Benlysta, the announcement this week about the FDA, approving Benlysta for additional treatment for lupus patients. So we wanted to touch on those two topics. And then, like I said, any questions that come up during the Facebook Live event here, feel free to chat them to us over our Facebook page or email us at communications@lfnc.org. All right, so with that, let's jump in. So Dr. Parsa, since the last time we had the conversation and office hours with you, there was some questions that came up around diabetes, and November being Diabetes Awareness Month. Many of us, I'm sure, including myself, have relatives and close loved ones that have diabetes. And similar to, lupus, diabetes is a challenge, especially during these times. Higher risk, with flu season now coming into the winter months, and then COVID just, of course, exacerbating that challenge as well, right? So wanted to the question really came across was given diabetes and maybe even lupus patients with diabetes are especially at high risk, and any recommendations, thoughts you have of things that lupus patients with diabetes, or even diabetes patients that may not have lupus, high risk patients, what are your recommendations that they should track and be aware of, especially during this high peak season with the flu and COVID spiking?
Very great question. Thank you, Jay. Diabetes is a very common disease. Unfortunately, it's associated with the being overweight or obese. And what we know about the diabetes is the glucose intolerance. Basically, the body needs more insulin to be able to use and consume, sugar. A diabetic patient would be considered as immunocompromised. The reason is we know that when the blood sugar is going up, the immune system, including the white blood cell, is not going to performing the normal task that they have, which is defending the body against all the viruses, bacteria, and all the offending agents and microorganisms. And so the number one thing that we wanted to make sure that the patients with the diabetes, the lupus patient with diabetes and patient with diabetes, have their regular, office visit or the Zoom visit with their primary physician to make sure the blood sugar is under tight control. If it's not, make sure that they need to just, discuss, about that their blood sugar hasn't been under good numbers, If it's not under the good numbers, we know there are going to be risk coming with it, including, more chance of the infection. And even when they're being infected, the body is not able to defend themselves. So if there is any problem with the blood sugar control, make sure that discuss it with the primary physician. If it's needed to be referred to the endocrinologist, because if it's a complex diabetic, condition, make sure that you get the referral, and make sure that they keep the blood sugar within the normal range. Hemoglobin A1C is one of the indicator, would give us, the average of the blood sugar within the last 3 months of the patient. And that would be our guide for if we have been implementing the proper and the right amount of the medication for the patient, and if the patient has been compliant with it. So make sure that keep the hemoglobin A1C below the lower, the better. But for the diabetic patient, we want it less than 7. If your blood sugar is not normal in the morning, make sure that you're monitoring it really well. If the numbers are high, make sure you discuss it with the primary physician to optimize your medication and the dosage of the medication that they have to take. At the same time, like other patients, make sure that, the patients would be considered as lupus and diabetes, 2 risk factor for immune deficiency, to just be, again, on top of the medication, following all the precautionary instruction, including using the mask and, the face mask, and the distance, and stay away from the public or any areas that, there is a congestion of the people. We're in the lockdown, situation, but even after that, they have to make sure that just minimizing the risk, which is the exposure, and having the proper, PPE and the mask and everything else, and keep the blood sugar at the best level possible. Discuss it with the primary physician. Continue with the supplementation as we discussed, the vitamin D, zinc, and vitamin C. And if there is any symptom, make sure that you discuss it with the primary physician, or look for go to some of the clinics that they might be able to check if they have the problem. With the lupus patient, we discussed it last time. Sometimes the lupus flare symptoms is resembles of the COVID-19, acute infection. The differentiation between these two is sometimes very difficult and challenging. So if you're having any symptom, non-specific fatigue, body ache, of course, fever, upper respiratory tract symptom, cough, or sometimes, 10-15% of the patients having GI symptom like diarrhea, cramping, any of the symptom that you never had before, and you start having it, make sure that you just check and seek for the medical advice through the Zoom or the urgent care available to check for the COVID. At the same time, if the COVID comes back negative, make sure you discuss it with your primary physician or the rheumatologist to make sure it's not the symptom of the lupus flare, because a lot of the symptom could be very has a lot of resemblance. So we want to make sure that it's not a lupus flare, and if it is, we're treating it properly and immediately.
Great. Thank you, Dr. Parsa. Yeah, you touched on something there that we've talked about in several office hours with you, and especially for, lupus patients, diabetes patients where their immune system is compromised. You touched on it here, but I think it would be good to refresh everyone's thoughts around, the benefit or potential benefit of boosting your immune system, through some supplements. Particularly, you've talked before about vitamin C, vitamin D, and zinc. Do you want to touch on that briefly and maybe just share kind of like recommended, dosages per day that can really help boost, your immune system, whether your immune system's compromised with lupus or diabetes or not? I think it's actually a benefit for anyone, but especially those that have a compromised immune system.
Definitely. That's a very, very good question. A lot of studies so far documenting and reinforcing the fact that the vitamin D, as we knew before, it's an immunomodulator, has the 2 major function of the vitamin D. Is one, the deposition of the calcium in the bones and absorption of the calcium and the hemostasis of the calcium in the body. That's the main function of the vitamin D. But when the level of the vitamin D goes above the 50, the second and the major effect of the vitamin D is going to be coming to the picture, which is the immunomodulation. And as we discussed before, the immunomodulation is that the immune system still strong enough to just, fight against all the viruses, bacteria, and microorganisms attacking the body. At the same time, it wouldn't attack the own body and the host, which is the whole concept of the autoimmune disorder. And the vitamin D has a major role on that. And unfortunately, as we know, the large number of the population, their numbers here and there from 40% to 80+% of the people might be vitamin D deficient or insufficient. Even if their numbers is above 30, it would be considered normal, but the immunomodulatory effect of the vitamin D is still not there. So I would highly recommend discuss it with the primary physician and targeting it to get to the 50 and above number to make sure that we have all the benefits of the vitamin D, including the immunomodulation. Generally speaking, the book and a lot of the textbooks and the recommendation from the guidelines talking about the 2000 units of the vitamin D. But my personal experiences, which is anecdotal, is telling the 2000 is not going to be enough. I always tell my patient to take 5 to 10,000 daily, but make sure at some point, ask your primary physician to check the vitamin D level to know where we are at and targeting it based on that number. If it is too low, we have to go with the weekly 50,000 as well as the 5 to 10,000 daily until we get to the safe zone, which is the 50 and above. So that's very important for the people who doesn't know their number, as far as, they haven't done the test or it hasn't been requested, the test. I would recommend to go with the 5 to 10,000. Some people are having concern about the overdosage. It's not easy to overdose the vitamin D. And since my 20 some years of the practice, the only case I've seen was one patient that was being a little bit high of the vitamin D, but everything that I've seen was the low vitamin D and the deficiency of the vitamin D. So, and by taking 5,000 a day, you're not going to overdose it, easily, even if it's very difficult to even replace the number. So continue with the 5,000 daily. Make sure your primary physician checks the baseline and know what it is. And if it is very low, they would recommend to just go with the 50,000 to boost this and bring it, above the 50 to be on a safe side. Vitamin C and zinc, also two other elements that has a major role for the immune system and the function against the viruses. That's why we just go with the cocktail of the 5,000 minimum of the vitamin D, 25 to 50 milligram of the zinc daily, and 1,000 milligram of the vitamin C, plus the high protein diet. Every average person needs at least 60 plus grams of the protein daily. And the protein is the major elements of the antibody and the function of the immune system. And sometimes some people might have some GI and digestion problem. So I would highly recommend, especially if you're having some symptom, make sure that you get some good organic protein powder and try to just, supplement yourself with the additional protein to make sure that you're getting minimum 60 grams of the protein daily. If you're having fever, you might need even more protein, but the minimum is 60 grams per day. And one of the things I would always recommend all of my patients is taking some multivitamin with minerals, because sometimes during the daily diet, we might not take, enough of the trace elements and the vitamins that we need to take. So it's highly recommended to be taken. And with the diabetes we already mentioned, we have to just keep the blood sugar less than 140 as much as possible with the medication, exercise, and the weight loss. And make sure if the numbers is not at the good number, discuss it with the primary physician to keep that number at the best possible. Make sure you have daily exercise. Sleeping is one of the major things that making the good maintenance of the immune system and the whole hemostasis of the body. Make sure you have a deep quality of sleep, 8 hours a day, and some techniques and things that they can do for the stress management, including exercise, meditation, whatever is helping them, good movies, keep in touch with the loved ones and their families. That these are all making your spirit and your emotion to the higher level, which is very well correlated with the immune system. So good food, good diet, good sleep, and good spirit and exercise. These are all going to be very helpful.
Great. Thanks, Dr. Parsa. Yeah, I mean, in a nutshell, it's kind of live a healthy, eat healthy, get your sleep, and make sure you're getting your vitamins and so forth, either through diet or through supplements. And I will say it's interesting, some of the studies, especially around vitamin D, I've seen as high as 80% of the US population, their vitamin D levels are below 50, right? Which is really the level to kick in, the kind of the turbo boost level for your immune system. And with COVID and being shelter in place and people not spending as much time outside, and not getting vitamin D even through the sun, it makes it even more challenging to keep your vitamin D levels up there. So I personally been on the 5,000 a day vitamin D since you recommended that to me back in March in our family. And so it sounds like you're still recommending the same levels. So great.
For
Thanks.
now, yes.
Thanks.
Unless,
Thanks
we know the number is lower, which
yeah.
but based on that, we just give the individualized, dosage for every patient. But if they don't know the vitamin D level and they want to just make sure that they're getting the minimum amount, so 5,000 would be a good number of the vitamin D3 that to be taken daily, and not to be worried about overdosing the vitamin D. That's not easy, and it's almost impossible.
Hard
with
to
the 5,000 to get to that level. Yes.
Well, great. Okay. Well, hey, that's a great update, and thank you for sharing that, especially since we had our last call before Thanksgiving. And so let's shift gears now. So this week there was a lot of obviously news and press around the beginning and the distribution of the vaccine for COVID-19. And we wanted to open this up and have you share your thoughts and recommendations for the lupus patients out there that might be thinking, should I get the vaccine? Should I not get the vaccine? So your thoughts on that this week, as far as, it's available now, it's starting to, ship across, United States and globally. What are your recommendations and thoughts that you'd like that you could share with our lupus community?
Very good question. I'm so glad that, we got to this point that the vaccine is available and it's already been delivered to the healthcare providers and the very high risk, population that they're going to start the vaccine. So as you know, for the FDA to approving the vaccines, there is three phases that the vaccine needs to go through. That 3 phases to be approved by the FDA. Phase 1, phase 2, phase 3, which is the animal studies and the safety of the vaccine that they're giving and the efficacy of the vaccine. And this is an unprecedented, way of, less than a year that the FDA approved from the beginning to the delivery of the vaccine under the Emergency Act. And the reason is that pandemic is just, affecting the whole society and everything in the world. But the great news is more vaccine with a different mechanism. So the vaccine, let's just explain what the vaccine is. Vaccine is usually just, making the immune system to be exposed to the part of the virus that they can make the antibody, or just being able to just defending the body against the virus. The vaccine that is available is an mRNA SARS-CoV-2 BNT162b2 made by the Pfizer BioNTech. And this vaccine is having the part of the mRNA of the SARS virus or the COVID virus that would let, so there is a spike protein that the virus would be attaching with this protein to the body, to the ACE receptors. So basically by having this vaccine, the body would be able to produce the antibody, neutralizing antibody, and also the immune system, cell-mediated immunity through the T helper, which is the one subset of the lymphocyte, to just having those neutralizing antibody available. Studies so far with the limited number of the human, subject has shown the relative safety of this. Of course, we not 100% sure in the long run, there might be some concerns about, the health. But generally speaking, so far with all these 3 phases, which was very accelerated to be finished and to be approved under the Emergency Act by the FDA, showed that this vaccine is very safe and has almost 95% efficacy for protecting and producing the antibody, neutralizing antibody, which doesn't let the virus to be attached to our cells and get inside the body and starting the infection. It's recommended for the patients over the age of 16. And of course, it would be delivered based on the risk stratification in the community. It would start with the very high risk, population, which is the healthcare provider, first responders, and the residential people of the nursing homes that they're at the maximum level of the mortality. So they're going to start with this, and then on a stepwise fashion, they're going to give it to the rest of the population in a 5-phase, phase 1, phase 2, phase 3, phase 4, and phase 5, and eventually would be able to just, vaccine, deliver the vaccine to the whole population of the United States. There is a possibility other forms of the vaccine would be available soon. And we don't know when or how it's going to be working, but for now we're recommending, if it's you're in the group of based on the stratification system, the vaccine is available and offered to you, discuss your condition with your primary physician. Generally speaking, we want everyone to be vaccinated, even if they had documented, SARS or COVID, infection in the past. We still wanted them to just get that one. One of the things that I was reading on the UpToDate last night, the recommendation by the FDA is, if you have got, the COVID within the last 3 months, wait at the end of the 3 months to get the vaccine. So let the rest of the population get the vaccine, and then you get the vaccination. The question would be, why somebody who is getting the COVID needs to be vaccinated? The answer would be because, by that exposure, it might not be producing neutralizing antibody, which has a major protective effect for the vaccine. And then this vaccine is offering for those neutralizing antibody. How long would it stay in the body? We still don't know, but at least several months, we're expecting that would be available in the body. One of the things we know about the vaccines and exposure is the body, when it's exposed to part of the antigen of the vaccine, would be producing some of the immune cells and the memory cells for the next exposure, even if the level of the antibody is not after a while just going down and would be faded in the serum. Those memory cells is there that reactivated if they're getting exposure to the COVID and responding much faster and better way with the real virus if they're being affected by. So there are a lot of hope coming that hopefully with this vaccination and other vaccines that come into the market, we're just getting to the end of this pandemic and being able to just, minimize the number of the mortalities and morbidities from this virus, which is a great news. Of course, a lot of things we still need to wait, and it would be revealed at the end of this. We're still collecting information and data from our studies, but so far the results are very promising, and I'm so glad that this vaccine is available.
Good. Yeah, no, it's good to finally see it, getting out there into the community, and at least, to your recommendation there, or to what you outlined, it sounds like it'll be rolled out in 5 phases, with phase 1 being the high risk first responders, medical community, senior care facilities and so forth. But then even if you have had COVID, wait, 90 days, 3 months or so, until you get the vaccine. So it's a great recommendation there, and great insights. Thanks for sharing that too, Dr. Parsa. One question that we did get is, what about lupus patients? So we have a question here that if you've just recently completed chemotherapy, or are even, in the process of chemotherapy and not through it yet, any thoughts, or what are your recommendations to the lupus patients that have recently completed chemo or in the process of going through chemo with getting the vaccine?
That's a very great question. We highly recommend for the immunocompromised patient, if it offers to them to get the vaccine, get the vaccination. Of course, discuss it with their primary physician, but the general rule for this group of patients are at the highest risk for the severe form of the COVID if they're getting the COVID. So the vaccine is going to have a very major effect on them and very detrimental. So we highly recommend, if it's being recommended or available for you, to get the vaccine. We don't know how much, the immunocompromised patient responding to the vaccine as far as producing the neutralizing antibody and immune system to be ready. Probably we're assuming that it might not be as high as the normal population, but we'll go, and if by the recommendation of the primary physician, if they're not making the antibody, there might be a consideration of getting the second booster of the vaccine again to make sure that their immune system is working. We know about the hepatitis vaccine has the same. The reason that we are having the 3 dosage of the vaccine for the hepatitis is, the population, when they're getting the first dose, 40% almost would be immune. With the second dose, 70-something% would be immune to it. And by the third one, 90+% of the people would be having the antibody against it. We still don't know about this vaccine. There is a possibility it would be recommended to have a booster in the future. But for now, if it is available, get the 2 dosage that they're giving it 3 weeks apart of the vaccine. And if they're immunocompromised, I would recommend to discuss it with the primary physician to check if the neutralizing antibody has been produced by their immune system. If not, consider the booster dosage of immune system. There is no instruction at this time, but I'm sure it would be available soon. But definitely we recommend, if you're immunocompromised, you're actually in the stratification phase, or among the second phase for getting the vaccine, because you're at the highest risk. If you're getting COVID, you might just getting the severe form that needs the hospitalization or more treatment, for the high risk group. So definitely answer is yes. Just consider and use the vaccine. The only contraindication for the vaccine so far is if there was any serious anaphylactic reaction or allergic reaction to previous vaccination in the past. That's one of the things that we have, and that doesn't mean that you don't need to get the vaccine, but we have to make sure that you just go to the proper place, that if the anaphylactic reaction happens, they would be able to just treat you at the place with the equipment. So, and they're recommending the places that delivering the vaccine have all the equipment ready if anyone gets any anaphylactic and allergic reaction to the vaccine. So if you have allergic reaction, you still can consider getting the vaccine, and we recommend to do that, but make sure to discuss it with the healthcare provider. Go to the facility that is properly, geared and ready for this kind of reaction if it happens. And we usually recommending them to stay 30 minutes instead of the 15 minutes for the regular population, to stay over there to make sure there is no reaction to the vaccine. So 2 things: go to the place like a hospital or close to the hospital, that in case that the anaphylactic reaction, they would be able to give you the treatment right away, and make sure that you stay at least 30 minutes after getting the vaccine. But there would be the red alert over there if there was a previous allergic reaction to the vaccine in the past.
Okay, great. All right. Thanks, Dr. Parsa. So let's shift gears a little bit from the vaccine to, this week, GlaxoSmithKline had FDA approval for additional, usage of Benlysta. And the Lupus Foundation, have been closely working with GSK for well over a decade, even when we were working with them on helping recruit hundreds of patients for the clinical trials for Benlysta that was approved by the FDA back in 2011 for SLE. And, that was the first drug approved, FDA approved for lupus in over 60 years. The previous treatment, was really Plaquenil, which was, developed back in the mid 1900s after the World War II for malaria. And so, it took 60 years to get the first treatment, through FDA approved for therapy with Benlysta for lupus. Now here we are 9 years later, still seems like a long time, but better than taking 60 years to, get through this trial with Benlysta now. And those that have seen it this week, maybe GlaxoSmithKline just got FDA approval for Benlysta, not just for SLE, but specifically now for usage with lupus nephritis. And so wanted to, open this up for you to share your thoughts with the lupus community around, what this means from, the FDA perspective. Also, it's exciting to start seeing, additional therapies come out and not taking, 2, 3, 4, 5, 6 decades, but here we are within a decade and, repurposing, Benlysta for a broader, therapy beyond just SLE to now lupus nephritis. So any thoughts there or recommendations that you have on the news this week with, GSK and the FDA approval for Benlysta?
That's a very great news. I have to thank you and everyone that just, supporting the Lupus Foundation and lupus research. And it's a great news that we have an FDA approved, medication for the lupus nephritis. As you know, the severe form of the lupus mostly are affecting the kidney to the level that, they go to the kidney failure. And it's very difficult. They have to get, very high pulse dose of the steroid to be able to control over this. And as we know, the steroid has a lot of side effects, and some of these patients has to be on the long-term high dosage of the steroid, which has a very negative effect on the general health and the body. This is a great first step. And like any other medication, as you see the history of the medicine, once the first medication is coming, then the cousins of that medication would be available much faster. That means that we already know which area of the immune system we have to just mitigate to just be able to creating medication. So this is the beginning of newer medication coming to the market and being approved by the FDA and preventing the major bad effect of the lupus, which is affecting the kidney and sometimes to the vessels, which is the too severe form of the lupus, which has the highest mortality and morbidity over here. That's a great news. I believe that, this is going to minimize the number of the patient having serious bad outcome of the lupus nephritis, and would be a great, medication that we would be able to just controlling over lupus nephritis, minimizing the disability and the patient needs, because most of these patients might be ending up to the kidney failure and being depending on the dialysis. So basically, we're going to minimizing the numbers going to that path and keeping them up and preventing that horrible effect happening in the kidney. So this is great news. I believe that in the future, the publication and the numbers going to give us a lot of great news because of this, and not letting the lupus patient with the nephritis to be affected by this effect of the disease with this medication. And I'm sure more medication with the resemblance and the same mechanism, it will come to the market right after this. It always happens when the first medication is coming. It means that we find the proper spot to just target the disease, and now more medication with the close action, it would be available soon. So that's a great thing. And I hope, the result which we're expecting to show to minimize and decreasing the number of the mortality and morbidity because of the lupus nephritis to be available. We'll hear soon, and the result would be ready, and we would love to share those information after this FDA approval and using it for the lupus nephritis. That's a great news. That's a very great news and a success and a turning point in the lupus nephritis, which we didn't have any medication except a very high dose of steroid, which we don't like to give it to the patients for a long term. And the side effects of the steroid, which we know it's very dangerous.
Yeah, no, for sure. And, it is exciting because, with the Lupus Foundation, obviously our main focus is working with, lupus community, lupus patients around advocacy and education and awareness to make sure the community is up to date. but we also work closely with the research, side of the medical community and the Lupus Research Alliance. I remember the trip to Washington, D.C. when we were advocating for additional funding for lupus patients and meeting with our senators and Congress, men and women and so forth. And this was like 2007, 2008. And we were there with our partnership with GSK. And, this was, like I said, over a decade ago. And to see, the progress and the FDA approval of Benlysta in 2011 was a huge breakthrough. And we're, excited now to see, hey, it did take another 7 or 8 years, 9 years to get to this, next therapy. But to your point, Dr. Parsa, we're confident that the momentum now is picking up and additional therapies and more research and so forth will continue to improve and accelerate for our lupus patients and lupus community. So great news this week with GSK and the FDA approval, of Benlysta. And just also
I want to thank you on behalf of myself and all the lupus patients for all the great, effort and time that you put. I personally know how much you care about the whole community, including the lupus patients, and you have been working really hard to just make this happen, and your team. And this is the teamwork. I just thank you personally and sincerely for all the great effort that you made to make this happen. And again, hopefully we're going to have more medication coming with almost the same mechanism. It happens with SSRI. When the first SSRI, Prozac, came to the market, the second, the third, and the fourth just came right after with a great result, and that reforms the treatment of the depression. Remember, it was in the 1980s when it came to the market. So this is the beginning of the new era of the good treatment available. So Benlysta is the first one and the prototype, and then after that there would be more medication available. Thank you, Jay.
Yeah, absolutely. And so actually just to shift gears now. So there's been a couple questions that have come through here that I want to touch on, kind of back to what you were talking about earlier, Dr. Parsa, in the vitamins and supplements. We have a question that came through as far as, let's see here, if a patient takes omega-3 fatty acids from fish oil, is there a lead or mercury risk that the patient should be aware of?
Supposedly not, but one of the things I would recommend for all the supplements that you're taking, if there is an organic or a non-GMO form of the medication available, so try to just use those. The omega-3 is supposed to be extracted, and based on the information that we have, it's not supposed to be contaminated with the mercury or other things. And again, if it's organic, it would just give us a little bit of more ease of mind. So the answer is, based on the information that we have, we shouldn't be worried about the omega-3 to be having some mercury in it. No, there is no need to be worried about the omega-3 and the mercury intoxication.
Okay, great. And the last thing here was really just to repeat or summarize again, as far as, let's see, the levels of supplements and so forth lupus patients ought to take. And so let me try to summarize this and then correct me where I might be off for Dr. Parsa. But what we had referred to earlier here in the session was for zinc, take 25 to 50 milligrams per day. For vitamin C, 1,000 milligrams per day. And then for vitamin D, it's 5,000 per day, up to 10,000 per day. But the goal is, when you get your blood work done, check your vitamin D level, and ideally your immune system really kicks into turbo boost mode when your vitamin D is above 50. So 50 or above your vitamin D levels in your blood work is your recommendation. So
that is correct.
How did I do? How did I do?
You did great.
Good. Yeah. You're not nervous about me taking over your job or anything? No, hey, so great advice. And I know we're a little over time here. We try to keep these to 30 minutes, but there was a lot going on this week that I'm sure was top of mind for our lupus community and patients out there, especially around the vaccine, as well as FDA approval on Benlysta this week. And as always, thank you so much for taking your time on a Saturday. I know you've got a lot going on with your patients in practice and so forth. And we truly love having you. And thank you so much for the support for the Lupus Foundation and our community. So with that, Dr. Parsa, and for everyone else out there, again, if you have any questions, please go to lfnc.org/COVID-19 or send us your questions anytime at communications@lfnc.org. And we'll get back to you over email, and then also for sure address them in our next office hours here with Dr. Parsa. So as always, Dr. Parsa, wonderful to see you. I look forward to seeing you in person here soon. And thank you again for your time and joining us here this morning.
Thank you so much, for all the effort and everything that you have done for the community and the lupus patient. Jay, thank you for having me and hosting me. And I want to just also say happy holiday to all of our patients. Stay safe. Great news will be coming up soon. And we're going to be defeating this pandemic and ending this tragedy for the world. So we look forward for all the great news and great year ahead. Hopefully, much better year in 2021.
Likewise. Well, thank you, Dr. Parson. For everybody out there, thanks again for joining. With the holidays and the new year coming up, our next office hours with Dr. Parsa will be the first part of January. So keep an eye out on our Facebook page for the upcoming next office hours in January, or you can always look for the update at our website, lfnc.org. Okay, thanks again, everybody. We're signing off, and great to see you again, Dr. Parsa. Take care.
Thank you so much. Thank you, Jay.
Bye-bye.
Bye-bye.